I'm not sure whether you know Dr. Peter Attia's book, Outlive.
I do, yes. Yeah.
So then from there, so he basically saying that it's not about we don't have the technology to screen you. It's just that the screen, the guideline is a trade-off of the cost. So now if I don't have a concern of the cost, it's not a burden on the public system, should I actually do all these, say, ultrasound, MRI, like a full body MRI, and whatever, like the technology, the imaging technology that we have, as not a screen for the public, but I just do it all myself.
So the question that's being asked is, there's a book written by a hepatobiliary surgeon, I think he's Canadian in origin, called Peter Attia, and the book is called Outlive. It's a really interesting book that says the healthcare system we live in and that Canadians live in doesn't make decisions around what is the best cancer screening. It asks what is cost effective for a population. And the answer is, it doesn't make sense to subject people to genetic screening of their entire genome. It doesn't make sense to do routine ultrasounds of the abdomen. It doesn't make sense to do blood tests for cholesterol markers, because in a population, it's super expensive to roll out those tests to every Canadian citizen. So we want to just pick the highest risk group and pay for those tests. For an individual, if you have the $1,000 for the blood test, or if you have the $5,000 to get a scan, or the $10,000 to get your genome sequenced, and the money is not an issue for you personally, why wouldn't you do all those things that might be able to detect cancer or heart disease or genetic risks as early as possible? So I guess my answer is sort of yes, but. So let me give you an example of whole body MRI. So there's some places that will scan your entire body with an MRI. That's a very hard test to do well. In order to do a whole body MRI well, you need a brain MRI doctor to read it, you need a lung MRI doctor to read it, you need a blood vessel MRI doctor to read it, a belly MRI doctor, and you're not focusing on one thing. Usually when you get a scan, you say, okay, I have a cough, I get a chest CT scan, do I have pneumonia or not? And the doctor sort of knows where to look. You're asking for really high attention paid to every part of the body. And if they find something, what are you going to do? If they find a little nodule in your lung, is that a cancer? Is it not? Do you want a thoracic surgeon to crack your chest open and take that nodule out when it might be nothing? So I think you have to figure out how willing you are to go all the way down the diagnostic path if you start on that. And that's why I really like the concept of these early detection assays, is that it doesn't look for a spot on an image. It looks for the mutations, as you know, that a little more complicated than that, but it looks for some changes in the DNA that suggest there's actually a tumor there, and it does make sense to go after it. Maybe it's not just the little dot of powdered sugar from the beignet.